Hi. Ooh,
Hello,
do I just
I'm Dr. Hamza Yusuf, and I'm going to be your guide to make your diagnosis. So you should be able to see your patient now and ask all the questions you want to ask, okay?
Hi, what's your name?
Well, name Sunenki. Her name is Suraya.
Hi, my name's Sena Kwon. I'm a intern at the public health internship. What brought you in today?
Wai me ya kawo ki yau? Me yake damun ki? Kun yaushe? Okay. She said she's been having this fever for the past 5 days with associated headaches and abdominal pain.
Does the fever come and go, or does it like stay the entire time?
Wai zazzabin nan yana nan ko da yaushe ne ko yana zuwa ya je ya dawo. Okay. Okay, the fever is actually on and off.
Okay. Does she notice, does she have any like fatigue?
Okay, wai kina jin ciwon jiki ne? Okay, yes, she has some fatigue and also some joint pains.
Um, does she have any like yellowing of her like eyes or her skin?
Okay. Wai idanki ya yellow ne? Yellow na tambaye ki. Okay. Okay, she doesn't have any yellowness of the eye.
How old are you?
Wai shekaran ki nawa? Okay, she's 28 years old.
Are you married or have any kids?
Wai kina da yara ne ko kina da aure? Ake yaran ki na yanzu ke da wa kike zaune. Okay. She's not married. She's actually a divorcee, but she also has two kids.
Okay. Where you live, is it like hot and like dry? Is it hot and like humid? Do you live like near water? Is there grass or is it just mostly dirt?
Wai inda kuke zaune kamar fadama ne ko kuma ya wajen yake? Akwai ruwa ko kuma ya wajen yake? Okay. Where she lives actually is a kind of a humid area, and their house is also surrounded with some bushes, and they have a well in the house.
You have a well?
Yes.
Okay. Does it rain a lot for most of the year, where you live?
Well, akwai ruwa sosai, ana ruwan sama sosai ko da yaushe. Okay, it rains only during the rainy season, like currently for about 5 to 6 months. And currently they're actually having a lot of rainfall.
What's your religion?
Wai me addinin ki? Okay, she's a Muslim.
Um, does she use the well to, does she get her water from the well or is there somewhere else she gets her water from?
Okay, wai ana kuke samun ruwan sha? Hmm? Yes, she actually gets the water from the well for drinking and other household chores.
Do you wash your hands regularly after like you go to the bathroom and like after you eat?
Wai kina wanke hannunki idan kamar misali kika zaga banɗaki ko kuma kafin ki ci abinci? Eh? Okay, yes, she does wash her hands.
What is your like day-to-day meal look like? Do you eat like mostly vegetables? Do you eat like protein? Do you eat grain?
Okay, wai abincinki me yake akasari kuka fi ci ne a gidanku ne kam? Kamar da me kuma? Sai me kuma? Oh, Okay. Um, kuna ɗan samun ɗan ganye wani lokaci ko ɗan nama a cikin abinci? She actually eats lots of carbohydrates. She
Mhm.
usually has rice or maize bread or occasionally she does have some meat, but it's just occasionally.
Um,
Would you like to ask if there's any gastrointestinal symptoms like uh
yes.
okay. Well, kina ji kamar akwai kina kamar amai ne ko gudawa ko tendency? Okay. Amma da akwai? Okay. She occasionally has some abdominal pain that is associated with some nausea and occasional vomiting, but there are no any loose stools or constipation. Mm.
Does she ever have a craving or like a want to eat something that's not food like dirt or like sand?
Okay. Wai kina so wani lokaci kamar ki ji kina so ki ci ƙasa ko kuma irin wannan abubuwan wanda ba a cika cin su ba? Kina cin ƙasa? Eh? Kamar ki ci ne? Okay. Yeah, she does actually have cravings for sand at times. Okay.
Um, so I suspect you have uncomplicated malaria with mild anemia. So I'm gonna order a rapid diagnostic test and a full blood count to see if that is actually true.
Okay. So we have some results here with us. She has, we did a blood film which showed two classes of malaria parasites. And we also did a complete blood count that showed a hemoglobin level of 9 grams per deciliter. And we also did a Widal test for typhoid fever, which turned out negative.
So now that your results have come back and you have received that you do in fact have uncomplicated malaria and a mild anemia. So what I'm gonna do is prescribe you some anti-malaria pills. And did she say she have a did you say you had a fever?
Yes, he had a fever.
So anti-malaria pills and some medicine to reduce the fever and to reduce the discomfort. And I'm also gonna prescribe her iron supplements that are pills so that she can take them every day. And also some B12 supplements, folic acid, and some vitamin C supplements so the iron can go faster into her body.
Good. Perfect. So wai tana so ta ce miki kamar kina da malaria, kin gane? Sannan kuma za ta baki maganin malaria da kuma saboda tana da kamar jinin ki a ɗan ƙasa kaɗan, za ta baki maganin da zai ƙara jini kamar su iron tablets da su vitamin B12 da vitamin C ko za ta ɗan baki saboda ya taimaka ko? Yeah. So she's actually grateful for all the things that you said. So do you want to also talk to the patient about any other thing?
For prevention,
Okay, go ahead, please.
For prevention, I would recommend using like mosquito nets or bug spray. Mosquito nets when you sleep and bug spray for both at night and when you go out, so mosquitoes are less likely to come and infect you with malaria again. And I'd also suggest that you could use incense coils to repel the mosquitoes using the scent and try to get rid of any stagnant water that's around your environment if there is, because that is like the main source of where mosquitoes come from and how malaria spreads so quickly in your community. And for anemia, I would recommend you take a more balanced diet and try to eat more green veggies if possible and maybe some meat maybe instead of just fully carbs.
Okay. Wai tana so ta ce miki saboda ki kare kanki daga malaria ko? sai kina amfani da mosquito nets, sannan kuma kina amfani da insecticide wato maganin sauro, kin gane? Sannan kuma tana so saboda jinin ki da yayi ƙasa, tana so za ta ɗan baki kamar kina cin abinci mai kyau kamar su nama, kin gane? Su ganye a abincin ki ko? Da ki kare kanki daga malaria. Yeah, so actually, I've explained all the preventive measures that you recommended for your patient, and she's also been very grateful for your help, for your diagnosis, and for the treatment plan that you've outlined. So, is there any other thing else you'd like to tell your patient?
I tell her to not worry and not be concerned because we have prescribed her medicine that will help her feel better and become healthier so that she no longer suffers from malaria and hopefully doesn't suffer from anemia anymore.
Okay, wata na so ta ce wai kar ki damu, wai za ki warke insha Allah. Za ta saboda ki ga duk maganin da ake ba ki ko? Yeah. Okay, so personally, I must tell you that I am very, very impressed with your performance. I feel like uh, you were very lucid, and particularly when you mentioned about that hyper having craving for things like scents and what have you, and when you also outlined the treatment for the anemia that she had,
Mhm.
I feel I'm giving you a thumbs up. I'm very proud of your performance, and you should be proud of yourself too. Okay?
Thank you.
Yeah. So can I get to have a Yeah. So she's good. So have a nice day. Okay.
You too.